Welcome. My name is James, and I'm here to try to understand what you are waiting for and not having had your COVID vaccination. I hope this talk would address the concerns and fears and also some of the questions you've been having all this time. My plan today is to cover a number of areas, and as you can see from my agenda here, there are 9 steps. But before we start all this, may I first say people are not stupid. They have a lot of preconceptions, which makes it challenging when they come to have to make a decision on whether to have a vaccination in this challenging time of ours. Right, let's start with disclosure first and foremost. I am a doctor, a surgeon by training. I work locally in Hong Kong, and until the pandemic, I also worked outside of Hong Kong in the Greater China area, as well as a volunteer in Myanmar. Since COVID, I've had the COVID vaccine, Comirnaty or BioNTech vaccination, and survived it. And I've been supervising as the medical doctor in charge of the Community Vaccination Center in Hong Kong Island South for the past 3 months. Now, let me give you some background. Water flows downhill very easily. So I thought, and when I was asked to give and help with the vaccination 4 or 5 months back, I thought, well, it should be a cinch. After all, everybody's worried with vaccine and wanting to have a vaccination for COVID. They would be all streaming to the center. Unfortunately, that's not quite true. Getting people to go to vaccine today, it's a bit like taking water uphill. It is more than a little challenge. So what is vaccine hesitancy? Is that a Hong Kong problem or a worldwide problem? To date, I think it is a worldwide problem. And vaccination, much as some of us would like to think it's a civic duty, doesn't seem to be happening very much at all. Now, vaccine hesitancy as a mental hurdle in Hong Kong has been the result or culmination of a number of issues. The public doesn't trust the Hong Kong government. It does not believe it's been honest to its people in the management of this pandemic. The anxiety that all of us have been having in Hong Kong since the social unrest leading to today, in the 2nd year of pandemic, is an emotional reaction that is hard to turn over. Rumors and fake news abound, and particularly when the vaccination started, we had a number of teething problems which resulted in that people were more hesitant about the vaccine than ever. Sinovac was first given to the elderly, and supposedly there were a few fatalities involved, but without any clear information, the newspapers reported that a large number of people had sustained problems due to Sinovac. When BioNTech started a few weeks later, it had to be hurriedly suspended for 12 days, and at that time, very little clear reasoning was given to the public either. So all this added to the confusion. Moreover, Hong Kong, in many people's opinion, is COVID safe. There's no real risk to get COVID after all. We haven't got an outbreak like India, United States, Europe, and so on. Now today, internationally, vaccination comes with lots of rewards to persuade people to vaccinate. In the United States, I understand that in some cities or some states, you can get free marijuana if you want to do a vaccination. Nevertheless, in China, there are brand ambassadors for the different vaccination. Indonesia has taken the opposite route, fining people. In Hong Kong, we have created a very complex vaccine bubble allowance, meaning if 2 people can sit down for dinner, or 4 or 6 or 8 or 10, depending on how many people have been vaccinated. Nevertheless, most Hong Kongers are not attracted to this thing. People seeming to take the attitude of wait and see. They talk to their peers. Well, peers are usually people who would do what you would do, and if you're not vaccinated, the others won't be too. So there's very little positive support or compensation. So I'm going to go through a series of questions with you all and see how you think about it. Is there a danger? Should you vaccinate? If so, when? Now, this man is crossing the river. The bridge between his home and where he works has been swept away in the storm. So they strung a rope across this gorge, this huge river, and he has to cross, taking his bicycle with him, hanging on to dear life. Well, if you think this is strange and unusual, think of the number of people in Hong Kong who hang on to their masks for dear life every day when they go to work. They really are hanging on. Ask them, take off their mask, and they'll look at you in horror. Nobody would take off their mask because it's like this man. If you let go of your mask, it's like diving straight into the water and ready to be drowned. So this pandemic has been going on for a year, nearly 2 years now. And guess what? Everyone is hanging on for dear life. Despite this, they won't find and look for protection. Let's go and ask more questions. I've asked people, do you go out to work? And they say, of course we go to work. Well, when you go out to work, do you meet someone you don't know? Well, actually, most of them say, no, I don't. I stay away from people I don't know because they're dangerous. Don't meet anyone. Don't meet anyone at all. But they go to work in the MTR, the mass transit, and sit next to someone they don't know. They also sit next to someone they don't know in the minibus, the public transport, and so on. Yet they confidently claim they go to work and don't meet anyone. Imagine what a preconception this is to being safe. Well, I say these people must vaccinate. Furthermore, I ask Hong Kong people, do you buy Mark 6, the lottery ticket that everyone's in Hong Kong punts on in the hope that they might win a fortune and don't have to go to work? Well, most will confidently say to you, yes, of course I buy Mark 6. Do they take the winter flu vaccine? Well, some do, some don't. But those who buy Mark 6 and those who take the winter, they're punting. They're punting on something in the hope of getting something better. Well, my suggestion to these people, if you haven't been vaccinated, if you want to punt, why not punt on the vaccine? Well, the last set of questions is, do you read The Economist or a medical journal, established journal like The Lancet or the New England Journal of Medicine, and so on? Are the New Scientist, the Hong Kong Economic Times, trustworthy, reliable media? Well, actually, if you read these reliable media, you most probably are already vaccinated, so I don't need to talk to you. So, another last question. Have you ever been tested for COVID-19? A swab thrust up your nose and wiggle around? In fact, if you push this swab hard enough into the middle of your midline septum of your nose, you will be in agony. Well, many Hong Kong people are now suffering this torture quite regularly and periodically as the government tries to ensure that whatever outbreak is controlled rapidly by identifying those who have been infected. Well, why don't you get vaccinated instead? It's a far better way than to have to be thrusted with this thing up your nose all the time. Well, having asked those questions, you may think I've finished asking, but I have some more questions. These are the questions I pose to my students, volunteers who help me at the vaccination center when they come to work. And those who haven't been vaccinated, when I ask them the question, they usually say, actually, I'm just thinking, I'm waiting, I'm scared. Well, are you thinking about it too? Are you still waiting? Are you truly scared? Well, if I can really ask them long enough, they might even answer, well, I actually want to know what is a mRNA and what happens if it all goes wrong. And furthermore, if I keep pestering them, eventually they say, well, I want to be vaccinated, but can I be vaccinated if I have an illness? Or I have allergies, or I may be pregnant, I want to get pregnant, I'm breastfeeding. But to be honest, the answer to this is absolutely, you can be vaccinated. So, can I go back to my first thrust? People are not stupid, they have preconceptions. The death rate in Hong Kong today for vaccinated people is 0.01 per 10,000, whereas non-vaccinated people currently is 4.6. That's 29 times higher. Now, if you are not stupid, you would say, I should be vaccinated. After all, it's 30 times better than being not vaccinated. But the preconceptions stop you from thinking seriously and going to get vaccinated. So far, I've covered 3 areas. Now let's go and talk about COVID-19 or the coronavirus infection itself. Is the situation in Hong Kong and the world changing? Well, if you go to the website of WHO, you go to various things, I'm sure you'll recognize that things have changed in terms of the pandemic since last year. It has been over a year since there's been a pandemic, and things have changed substantially. So I think it's time you need to think differently. You can go to our worldindata.org website and explore the world data on COVID-19. I won't do it here. I leave you to do it, and you can go to the WHO website. But from the WHO website, the latest bulletin only a few weeks ago said that new COVID cases and deaths have slightly decreased on that week. But COVID deaths and incidents, however, remained at the highest level since the beginning of the pandemic. So the WHO acknowledges that COVID-19 isn't going away. Well, this is a chart showing COVID death in the line and COVID infections in the blocks. As you can see, it's still coming wave after wave. It might be going down, but really, in honesty, it will climb again. These peaks are still there, and wave after wave is coming. So COVID is not going away internationally. Let's look closer into the Asia-Pacific region. 2 countries. Let's look at India first. It goes without saying that all of you are familiar with this rising epidemic in India since March, April, and way into May. Hopefully, this would plateau eventually. But the number of people getting infected and the number of people dying is enormous. Australia, which was supposedly having a successful control and everything was open and everybody could start doing things, traveling, enjoying friendship, visiting neighbors, and so on, started a 7-day lockdown last week. In fact, this lockdown may proceed beyond 7 days. Why? Because of a new variant that is now spreading. Well, this new variant is B1.6.17a, or the Delta variant under the new terminology. And WHO has called this a variant of concern. It's of concern to the point where Australia, Victoria locked down completely. Think about it. You don't think this is changing? This is India now, currently. It could be somewhere else next, anywhere in the world. Hopefully, I've given you a picture that COVID is not going away, it's getting worse. But closer home in Hong Kong, actually, we're still very good. Hong Kong's COVID is really low and has been, despite the fact that the Delta variant, is now showing up in Hong Kong too. But more interesting is to look at the hospitalized asymptomatic versus hospitalized group of COVID victims in Hong Kong. We know the new variant is asymptomatic, mainly, and a possible super spreader. It spreads quite effectively, and when the person is infected with it, the chances of having severe effects, that is from mild inpatient care to intensive care, is large. So if you are not vaccinated and you go to work, the chance of you meeting someone asymptomatic is high. After all, it's 20 times higher in terms of asymptomatic people to hospitalize. And then, as you're not protected, the likelihood is you are going to have more severe symptoms, severe effects on you than those who are vaccinated. So, Hong Kong's not safe. Well, if you don't want to think differently, you can look at this new Hong Kong quarantine rules as explained by this person to me in an interesting flow chart. Are you a close contact? Yes. Are you vaccinated? Yes. But with BioNTech, good. Or you go and get quarantined. Other way around, you're vaccinated? No? Well, you better be quarantined. You're close contact? No. Are you sure? Yes, we don't care. Get quarantined. Are you sure? No, we thought so. Quarantine. Why are we quarantining so many people? It's because we're worried that you might get the Delta variant, which would spread, and you're asymptomatic. So, if you don't think differently, you better go down that route of being quarantined all the time. Don't go out. Don't meet anyone. Stay at home. So now, let's turn to vaccine and vaccination. There are 2 COVID vaccines available in Hong Kong. Comirnaty, which is the BioNTech, and CoronaVac, which is from Sinovac. As I've been working at the Comirnaty Center, I will spend most of my time talking about Comirnaty, but I will briefly touch on CoronaVac as well. Now, Hong Kong government website on covidvaccine.gov.org has a lot of information available in multiple languages beyond English and Chinese on both vaccines. So if you want to, scan these QR codes and go and search and have a look in detail if you don't feel I've given you enough here. Now, let's touch briefly on vaccine approaches and how the 2 vaccines are different. CoronaVac is an old-fashioned vaccine using live attenuated virus. In other words, the virus is killed before it's injected to you in order to stimulate a reaction so that your body will build antibodies and retain memory cells that when you get an infection, it will rapidly assemble antibodies to protect you. That's the approach of the traditional vaccine. It has an advantage that it is well-studied methodology of making vaccines, and the side effects and the risks long-term of this are well known to be low and unlikely. So therefore, it's a safe vaccine to utilize for anyone who wants to be vaccinated. The modern approach with the mRNA, it's unique and interesting in the sense that it is not using the virus, but it's using a synthetic molecule called mRNA, which is a messenger RNA that contains the spike protein of the coronavirus, similar to coronavirus, so that when you give it to the body recognizes and is able to make antibody, creating an immune response. Now, this approach is new, and there are some issues related to it. That's why I'm going to address it in detail. Firstly, this is new to patients and the public, but not to medical researchers. This technology has been studied for several decades in the use and prevention and treatment of various diseases and tumors and so on. The mRNA vaccine sends a message to the body's immune system to produce antibodies. It does not enter the cell nucleus to create defects and interacting with the DNA to create defects. It's genetic technology that does not change the DNA of the host, and it does not contain a live virus. So, for those who are worried, there is no risk of creating coronavirus infection using an mRNA vaccine. And these vaccines have been tested before it is used. Now, when we do vaccination to people and people have vaccines, there are 2 things that happen. Firstly, there's a reaction that everybody will get, some to a mild degree, some to a larger degree, and there is allergic reaction or allergies to the vaccine. Now, for the Comirnaty BioNTech vaccination, we only give a tiny, minuscule amount of fluid, 0.3 mils, into the arm, the upper arm of the individual. This amount of fluid is enough to create a reaction in your body, to create antibodies, and create a memory in your body system. Now, when you have a vaccine, you have reactions. These reactions, or reactogenicity, is not the same as having side effects or adverse side effects due to the vaccine. These reactions are usually transient and usually not severe. They are muscle aches, joint aches, headaches. You can get mild fever, you can get fatigue, and these last for a short time. You can get some allergic reactions, but I'll discuss that in detail in the next slide. But these allergic reactions tend to be severe or immediate. Now, since the vaccination has started, statistics have been kept carefully by all the international players so that we know what adverse effect has been going on, and we know that the adverse effects are mild, small, and not consequential. People are not dying like flies like you would if you were having COVID. So what is a vaccine allergy? Allergic reaction can be to any component of the vaccine. It could be to the vaccine mRNA itself or the carrier fluid which the mRNA vaccine is held in. But medically, we classify vaccine allergies into a number of types, as all allergic reactions are classified. There's type 1, 4, and 3. I won't talk about type 2 because this doesn't apply here. Now, type 1 is the most significant of all allergic reaction after a vaccination. It's called an anaphylactic reaction to vaccine. It's about 1 per million doses. Anaphylactic reaction happens when someone within a few minutes to 15 minutes of a vaccination falls unconscious, drops their blood pressures, is getting cold and clammy. This reaction requires to be immediate treatment by the medical team on the site of the vaccination center. So at the vaccination center where I work, I have a full resuscitation capability, adrenaline, and the necessary drugs are all available in order to help someone with this. But remember, this is rare. In Hong Kong, we're likely to see maybe a dozen or so people if everybody were taking the BioNTech Comirnaty vaccination. Type 4 is what we call a delayed hypersensitivity reaction. Is usually a few days later, but these are usually mild and spontaneously recover. So it's not an allergy reaction that you should worry about even if you have it. The type 3 reaction is definitely a rare one, and this is when you hear about paralysis and so on. But again, these are usually reversible over time. So all types of allergic reaction are manageable if you are being given a vaccine in a proper environment like what we have set up in Hong Kong. Now, these are not allergic reactions. Getting a fever, redness, swelling, pain, those reactions are not allergic reaction. People can faint, what we call a vasovagal syncope. These are associated and usually are more of a panic scenario. And these, again, people recover from all this and are not allergic reactions. So, in terms of COVID vaccine allergy, the international reporting system has a record of how many cases, and we have a flowchart, which I'll come back to later on, of how you should look at if you are considering and are worried. Now, one thing we should be thankful to him is that he pushed the American manufacturers to make vaccine quickly and in order for all of us to be able to have vaccination. In fact, he vaccinated himself without telling people much, much earlier than all of us. So why are you still skittish about vaccination? Well, you're concerned about risk and odds. I truly understand that. But having discussed with you now so far, you must realize that the greatest risk of vaccine, and particularly the BioNTech Comirnaty vaccine, is anaphylaxis. And as I said many times now, it's 1 in a million dose. In Hong Kong, the chance of winning the first prize of Mark 6 is 1 in 14 million. So really, you most stand a chance of winning the Mark 6 if you go and vaccinate as well. Right, Mark 6 benefit is much better than vaccine. No, vaccinations benefit far better than vaccine. But the COVID mortality rate is 2%, 20,000 per million infection. Isn't that far higher a risk? Or is your preconceptions about the dangers of the vaccine holding you back? Seriously, COVID is far more dangerous. Let me look at risk in a different way. Here is some charts that I pull out from the Hong Kong Road Transport Department on road traffic. The four charts, the top two are road traffic accidents monthly on the left side. The right side is fatal accidents on the right side, and the left side is monthly road accidents. You can see that the trend on road accidents or fatal road accidents hasn't gone down over the past 5 years, from 2006 to now. This is despite the pandemic, and you can see in the bottom left-hand chart that the public transport journey numbers have gone down significantly in 2020. So it is still lethal on the road. And people are worrying about vaccination. You should be worrying about dying on the road. Dying on the road is far more dangerous. And if you don't believe me that the numbers have gone down, look at the lower right-hand side where I broke down the transport figures from buses, MTRC, public light bus, and ferries. Everything has trended down the last 2 years, but death on the road has not gone down. In fact, if I look at the actual number and calculate it for you for the year 2020 and backwards 3 years, the number of fatality on the road rate is still 14 per million, and 19 per million. So the numbers of death on the road is far higher than the risk of a vaccination, and yet still lower than COVID. So think carefully, what is risky? What are you worried about? Well, I've covered 1 to 7. I still come back to you. You are not stupid. You have preconceptions. Think differently. Let me go to this last few slides. One of my colleagues who works with me had put this nice little chart on the benefit of COVID vaccination. He said you protect yourself, you look after yourself, you look after your friends and family if you vaccinate, and you then look after your society, and finally, you can look after the economy. Because if you're vaccinated, your friends and family will be vaccinated, they'll be safe, and if they are safe, the society will be safe and your economy. Well, I have a different view on that one, and I'll come to it in a minute. How can you decide whether you should vaccinate or not? Well, here's that flow chart I promised you about. If you have a severe allergic reaction to 1, 2, 3, or 4, then these are the questions you ask yourself. If you say yes to number 4, that is allergy to PEG, which is one of the stabilizing component in the BioNTech vaccination fluid, then you are a high-risk person and you probably should not take BioNTech, maybe the coronavirus, but you can actually have a check by an allergist to see and assess you before you have your first vaccination. You are a high-risk person. But PEG is not everywhere. It's in cosmetics, it's in Los Angeles laxative. But if you've had a laxative, you've had a colonoscopy, and you are still okay, and you didn't have an allergic reaction, an anaphylaxis reaction, then you probably got to answer no to number 4. So if you answer yes to 1, 2, or 3, you are a medium risk person who can be vaccinated readily. You go to the vaccination center and we'll keep you an eye on you for 30 minutes, and if you don't have a problem, we send you home. But if you answer no, and most people will be answering no to all 4 questions, then you are a low-risk person who should just turn up, get vaccinated. After 15 minutes, you can go home. Let's go back to that chart of vaccination. Let's put it that you don't care for yourself. That's why you're still thinking and you don't want to vaccinate. Well, you only care about economy. Well, if you only care for economy, there must be a functioning society. But since society is full of vaccine hesitancy, there won't be a society. After all, we're not getting vaccinated. If you're not getting vaccinated, your family and friends are not getting vaccinated either, so there'll be no economy. Think different. You're not going to get there. This is Hong Kong numbers today, appallingly low. You can go to the Hong Kong COVID vaccine website and see a daily update produced by the Hong Kong government. It just doesn't move anywhere. 28,000 per day, per 7-day moving average is an appalling number, since we were hoping to do 28,000 or so per center, and there are 22 centers in Hong Kong. This is awful. You know, COVID vaccination, BioNTech is risky because of anaphylaxis shock. But in Singapore, as of yesterday, they've invited 30,000 people with history of anaphylaxis to take COVID vaccination because they are so concerned about another outbreak coming in their country with the new variant that they have properly organized center that are inviting people with history of anaphylaxis to come. And here you are, many people with no history of anything, but you don't want to be vaccinated. Of course, the data now has gone beyond the fact that we may be thinking about pregnancy or breastfeeding. In fact, the American Obstetrician College has already confirmed that you can have vaccination if you're pregnant. You should not need a pregnancy testing prior to vaccination. And pregnant people should be given the option to be vaccinated with COVID vaccine. So, time has gone, things have moved. This young boy says, "Can I have a snack to mum?" And mum says, "Sure, help yourself." Well, she said, "You can have an apple and orange from the fruit," while young Timmy has gone and got himself some cookies. The trouble is this, you see, even though both of them are speaking English, they're not speaking the same language. I hope you and I are talking the same language. You are not stupid. You have preconception. You really need to think smart. Think differently. Stop thinking, stop waiting, stop being scared. There's nothing to worry about. Think smart.